Hello. Just this past week, three of my patients, three wonderful seniors I've known for years, suffered heart attacks. Thankfully, all three of them survived and are now in recovery. But they all shared one frightening and dangerous detail. Every single one of them missed the early warning signs. They dismissed them, explained them away, or simply didn't recognize them for what they were. A desperate cry for help from their own heart. This happens far more often than you can imagine, and it's a tragedy that we have the power to prevent. The truth is, the classic heart attack we see in movies, the sudden, dramatic clutching of the chest, is not the reality for many seniors. The real signs are often subtle, quiet, and incredibly deceptive. And today, I'm going to teach you how to recognize them. Let me tell you about Margaret, a retired librarian in her late 70s and one of those three patients. For 2 days, she had a nagging ache in her jaw. She was convinced it was a dental problem, maybe an old filling acting up, and she made a note to call her dentist on Monday. Then there was David, a former construction worker who prided himself on his physical toughness. He experienced what he described as bad heartburn and some nausea. He took a couple of antacids and figured he'd overdone it at dinner the night before. Neither of them, not for 1 second, thought their heart was in trouble. Their symptoms just didn't fit the picture they had in their minds. This is the critical disconnect I see time and time again in my practice, and it's what makes these situations so perilous. They were listening to their bodies, but they were misinterpreting the language. My name is Dr. Robert Clark. For over 30 years, I've had the privilege of specializing in geriatric medicine, focusing on the health and vitality of our senior community. In that time, I have sat across the desk from thousands of patients and their families. I've celebrated their triumphs and guided them through their health challenges. And I've also sat in hospital rooms with families who are reeling from a sudden, unexpected cardiac event, often hearing them say the same heartbreaking words. We just had no idea. There were no signs. My mission and the entire purpose of this video today is to change that for you and your family. I am here to give you the knowledge that can turn a potential tragedy into a success story. Because the signs are there. You just need to know where to look. Over the next few minutes, we are going to walk through the 7 most frequently missed warning signs of a heart attack in seniors. These aren't just textbook definitions, these are the real-world symptoms that my patients experience. We will discuss why they are so easily mistaken for normal aging, everyday ailments, or other chronic conditions. I will give you clear, practical guidance on what to watch for, and, most importantly, when you must act without hesitation. This isn't about causing fear, it's about empowerment. Think of this as a crucial safety briefing. The knowledge you gain today could equip you to save your own life, or the life of a spouse, a parent, a friend, or a neighbor. So please, give me your full attention. This is that important. Before we dive into the first sign, let's be clear about why this is such an urgent topic. Heart disease continues to be the #1 cause of death for adults over the age of 65 in this country. It's a statistic that is held for a long time. But here is the part of the story that often gets missed. A heart attack is not always a sudden event. It is often the final, catastrophic culmination of a process that has been developing for some time. In the hours, days, or even weeks leading up to the event, the body is often sending out signals. Think of them as tremors before an earthquake. They are your body's early warning system. A message sent directly from your heart that it is under severe distress and its oxygen supply is in jeopardy. Our job is to learn how to detect those tremors before the earthquake hits. So, why are these life-saving signals so frequently missed? The primary reason is something I call symptom overlap. As we get older, our bodies accumulate a sort of background noise of aches and pains. You might have arthritis, which causes joint pain. You might have acid reflux, which causes indigestion. You might have diabetes, which can cause strange nerve sensations. A new warning sign from the heart has to make itself heard over all of that existing noise. A strange feeling of pressure in the upper back? It's all too easy to say, "Oh, I must have slept on it wrong." A sudden wave of nausea? I shouldn't have had that second cup of coffee. We become masters at explaining away new sensations because they often feel similar to things we've felt before. Does this sound familiar to you? Have you ever brushed off a new feeling by attributing it to an old, familiar problem? This is the heart attack's perfect camouflage. There is also a physiological reason why the symptoms change as we age. The nerve pathways that carry pain signals from the heart can alter over time. So instead of a clear, strong signal traveling to the chest and left arm, it might get rerouted, showing up as an ache in the neck or a pain in the right arm. This leads us to another vital point we will explore in detail: gender differences. For far too long, our model for a classic heart attack was based on studies of middle-aged men. We now know, without a doubt, that women are far more likely to experience these so-called atypical symptoms. They often report profound fatigue, shortness of breath, and indigestion, frequently without any discernible chest pain at all. This medical blind spot has meant that women's heart attacks are more likely to be misdiagnosed and undertreated. We are going to shine a very bright light on that today. Let's begin with the first of these silent warnings. It is a symptom that almost everyone misattributes because it appears in a location that seems completely unrelated to the heart: your jaw and neck. Now, I'm not talking about a sharp, localized pain. I'm referring to a dull, persistent, and often spreading ache. It can feel like a deep toothache that you can't quite pinpoint, or a stiff neck that a hot shower just won't fix. It might start in the lower jaw and radiate up towards your ear, or it could feel like a heavy pressure at the base of your neck or across your upper back and shoulders. You might even feel it more in your back than your front. Because these are areas where we commonly experience pain from arthritis, dental issues, or muscle strain, it is incredibly easy to say, "Oh, it's just my arthritis flaring up," or "I must have slept on it wrong." Let me tell you about a patient of mine, a retired carpenter named Bill. For about a week, he had a nagging ache in his jaw and neck. He was a stoic gentleman, and he was convinced he'd just strained a muscle working in his wood shop. He tried icing it, he tried a heating pad, but the ache would come and go in waves. The most important clue, the one we identified later, was that the ache would get noticeably worse when he exerted himself. When he walked up the small hill on his street to get the mail, the ache would intensify. When he rested, it would subside. That connection to physical exertion was his heart's way of screaming for help. The reason this happens is a phenomenon called referred pain. The nerves that service the heart run along the same spinal pathways as the nerves from the jaw, neck, and arms. When your heart muscle is being deprived of oxygen, it sends out pain signals. Your brain, which is not used to receiving pain signals from the heart, can get confused and misinterpret their origin, telling you the pain is coming from your jaw or your neck instead. The next warning sign is perhaps the greatest masquerader of them all, because it perfectly mimics one of the most common ailments we all experience: indigestion and nausea. So many heart attack patients, especially women, initially believe they are suffering from a simple case of heartburn, acid reflux, or a stomach bug. They feel a burning sensation or a deep pressure in the upper abdomen, sometimes accompanied by bloating, belching, or a wave of nausea. They do exactly what you'd expect. They reach for the antacids. But here is the critical difference. With cardiac-related indigestion, the antacids often provide little to no relief. The feeling persists, or it may come and go without any connection to the food you've eaten. I need all the women watching this to please pay very close attention to this point. You are significantly more likely than men to experience nausea, vomiting, and stomach discomfort as the primary signs of a heart attack. It is one of the most common atypical presentations. So, when should you worry? The context is everything. If you experience sudden, unexplained indigestion or nausea that is also accompanied by other symptoms, even subtle ones, that is a major red flag. For example, are you nauseous and also feeling lightheaded? Are you breaking out in a cold, clammy sweat for no apparent reason? Do you feel short of breath? That combination of gastrointestinal distress plus any of these other symptoms is not something you can afford to ignore. It is your body telling you that this is not a simple stomach issue. This is a systemic problem that requires immediate medical attention. This brings us to our third, and perhaps most subtle warning sign: profound and unusual fatigue. Now, everyone feels tired. As we get older, we don't have the same energy we did in our youth. I understand that. But the fatigue that can signal an impending heart attack is different. This is not the normal tiredness you feel at the end of a busy day. This is a sudden, debilitating, bone-deep exhaustion that seems to come out of nowhere. My patients have described it as feeling like they've been hit by a truck, or as if they are coming down with a severe flu, but without the fever or other symptoms. It's an overwhelming sense of weakness that makes simple, everyday tasks feel like climbing a mountain. The biggest clue is when this profound fatigue is completely out of proportion to your activity level. For instance, you go to make the bed in the morning, an activity you've done 1,000 times, and you have to stop halfway through to sit down and catch your breath. You walk out to the car and suddenly feel overwhelmingly exhausted and weak. This happens because a struggling heart cannot pump enough oxygen-rich blood to meet your body's needs. Your muscles and tissues are being starved of fuel, and the result is this catastrophic drop in your energy levels. A staggering statistic from a major study revealed that about 70% of women reported experiencing this type of unusual, extreme fatigue in the days or even weeks leading up to their heart attack. Think of it as a brownout for your body's electrical grid. It is one of the earliest and most persistent clues that your heart, the central power plant, is in serious trouble. Our fourth warning sign is one that can be very disorienting and frightening: dizziness or lightheadedness. Your brain is an incredibly active organ, and it demands a constant, uninterrupted supply of oxygen-rich blood to function properly. When your heart is in distress and its pumping function is compromised, that vital blood flow to the brain can temporarily decrease. The result? You might suddenly feel dizzy, unsteady on your feet, or like the room is spinning. You could feel a sense of faintness, as if you're about to pass out. Of course, there are many reasons for feeling dizzy. You might be dehydrated, you might have low blood sugar, or you might experience the brief head rush from standing up too quickly. The key is to, once again, look at the context. Is the dizziness sudden, severe, and without a clear explanation? Did it come on while you were sitting or resting? And, most importantly, is it accompanied by any of the other signs we've been discussing? A patient of mine, a lovely woman named Helen, felt very dizzy one afternoon while sitting at her kitchen table paying bills. Her first thought was that her blood pressure medication needed adjusting. But she also felt a strange, heavy pressure between her shoulder blades, a symptom she initially dismissed. Thankfully, her daughter was with her and recognized that two seemingly unrelated symptoms happening at the same time was a major red flag. She called 911. That quick thinking saved her mother's life. If dizziness occurs in isolation, it's worth a call to your doctor. But if dizziness occurs with chest discomfort, shortness of breath, sweating, or pain in your neck, jaw, or arms, it becomes a potential medical emergency. Next, I want to group together 3 signs that I call the overlooked trio: shortness of breath, breaking out in a cold sweat, and pain in one or both arms. These are often the most deceptive symptoms, especially in seniors, because they can appear without any chest pain whatsoever. Let's start with shortness of breath. It's all too easy to attribute breathlessness to being a bit out of shape or just a normal part of getting older. But the shortness of breath that signals a heart problem is different. The medical term for it is dyspnea, and the defining characteristic is that it can occur with minimal exertion or even when you are at rest. If you are sitting in a chair reading and you suddenly feel like you can't get a deep enough breath, that is a serious warning sign. Your heart and lungs are a linked system. If the heart can't pump blood forward effectively, fluid can back up into the lungs, making it difficult to breathe. The second part of this trio is sweating. This is not the warm, healthy sweat you get from exercising or working in the garden. This is a cold, clammy sweat that often comes on suddenly and can leave you feeling chilled and damp. It's the physical manifestation of your body's stress response. When the heart is in crisis, it activates the sympathetic nervous system, your fight-or-flight response, which floods your body with adrenaline and causes this unusual type of perspiration. For women going through menopause, it's very easy to dismiss this as just another hot flash. But a cardiac sweat often feels different. It's colder and is frequently accompanied by a sense of dread or anxiety. Sweating without any physical exertion is never normal and should always be taken seriously. Finally, let's bust a major myth about arm pain. For decades, we have been exclusively taught to watch for pain in the left arm. While that is certainly a classic sign, it is a dangerously incomplete picture. The pain, pressure, or discomfort can occur in the right arm. It can occur in both arms simultaneously. It might not even be a sharp pain at all. Many of my patients describe it as a heavy, weak, numb, or tingling sensation that radiates down from their shoulder. Just like the jaw and neck pain we discussed, this is another example of referred pain. The nerve signals from your heart are getting misinterpreted by the brain. So please erase the idea that it has to be the left arm. Discomfort in either arm, especially when paired with any of these other subtle symptoms, is a significant clue. This brings us to one of the most important takeaways of our entire discussion today: the critical differences in symptoms between men and women. To put it simply, if you are waiting for the Hollywood heart attack to happen, you may be waiting for a sign that will never come, especially if you are a woman. While men are more likely to report the classic substernal crushing chest pain, that feeling of an elephant sitting on the chest, women are far more likely to present with a combination of these other subtler symptoms we have just covered: the profound fatigue, the shortness of breath, the indigestion or nausea, the pain in the back, neck, or jaw. This constellation of symptoms is the female face of a heart attack. The medical community has been slow to recognize this, and the consequences have been severe. Some studies have shown that women are 50% more likely than men to have their heart attack diagnosis initially missed in the emergency room. Why? Because their symptoms don't fit the classic profile that was based on decades of medical research conducted almost exclusively on men. Furthermore, as both men and women advance in age, everyone's symptoms tend to become more atypical and less obvious. This is why this knowledge is so vitally important for everyone over the age of 60. You have to be the expert on your own body and a strong advocate for your own health, armed with the right information. So now that you are armed with this knowledge, what do you do with it? What is the single most important action to take if you or a loved one begins experiencing a combination of these symptoms? The answer is simple and non-negotiable. You do not wait and see if it gets better. You do not schedule an appointment with your doctor for the next day. And you absolutely, under no circumstances, get in your car to drive yourself to the hospital. The first and only thing you should do is pick up the phone and call 911. I cannot state this with enough urgency. There is no room for hesitation. There are two critical reasons for this. First, if you are experiencing a heart attack, your condition could worsen dramatically in a matter of seconds. You could lose consciousness at the wheel, endangering not only yourself but everyone else on the road. Second, and just as importantly, the paramedics who arrive at your door are an emergency room on wheels. They can begin life-saving treatment the moment they reach you. They can administer oxygen, give you aspirin to help thin the blood, and perform an electrocardiogram, or EKG, to send directly to the hospital. This means the emergency room physicians can be waiting for you, ready to act the second you arrive. Those minutes, the time between the onset of symptoms and medical intervention, are the most precious minutes you have. In cardiology, we have a principle known as time is muscle. It refers to the fact that during a heart attack, a part of your heart muscle is being starved of oxygen and is actively dying. The longer that artery remains blocked, the more heart muscle is permanently lost. This is why we talk about the golden hour, that first 60 minutes after symptoms begin. Prompt treatment to open that blocked artery can mean the difference between a small amount of damage and a full recovery versus a large amount of damage that leads to chronic, debilitating conditions like congestive heart failure. By calling 911, you are not just saving your life, you are saving your future quality of life. You are buying yourself time, and you are saving priceless heart muscle. When the paramedics arrive, be ready to be a clear and concise historian. Don't just say, "I think I'm having a heart attack." List your symptoms for them, even the ones that seem minor or unrelated. Tell them, "I've had this dull ache in my jaw for an hour, I feel nauseous, and I'm overwhelmingly tired." The more pieces of the puzzle you can give them, the faster and more accurately they can treat you. And this brings me to a final point on seeking help. You must be an advocate. If you are with a spouse, a friend, or a parent who is experiencing these symptoms but is insisting they're fine, you have to be the one to speak up. It is a common human reaction to be in denial when something frightening is happening. Your firm, calm insistence on calling for help could be the single most important act of love you ever perform. I know that we've covered a great deal of information today, and much of it can sound alarming. But I want to be very clear. My goal is not to frighten you. My goal is to empower you. Fear comes from the unknown. Confidence comes from having knowledge and a clear plan of action. Let's quickly recap the 7 warning signs we discussed, so they are fresh in your mind. Number 1, jaw, neck, or back pain. Number 2, indigestion or nausea. Number 3, unusual and profound fatigue. Number 4, dizziness or lightheadedness. Number 5, shortness of breath, especially at rest. Number 6, breaking out in a cold, clammy sweat. And number 7, discomfort, pressure, or weakness in one or both arms or shoulders. The most important lesson to take away from our time together today is this. Learn to listen to the whispers from your body, so you never have to hear it scream. You are the world's leading expert on your own body. You know what your normal aches and pains feel like. You know what a normal, tired day feels like. If you experience a symptom that is new, different, persistent, and just doesn't feel right, I implore you to trust that instinct. Do not allow yourself, or anyone else, to explain it away as just another part of getting older. Your body is trying to tell you something important. Please give it the attention and the respect it deserves. If you have found this information to be valuable, I ask you to do one simple thing. Share it. Please send this video to your friends, your siblings, your neighbors, and your children. Everyone who has a senior in their life whom they love needs to have this knowledge. A simple share could truly be the link in a chain that saves a life. For more practical, no-nonsense health advice that is grounded in science and tailored for the needs of our senior community, please take a moment to subscribe to this channel. My very next video will be on the best heart-healthy foods you should be eating after 60, and I'd love for you to join me for that. Finally, always remember that this video provides general health education and is not a substitute for the personalized medical advice of your own physician, who knows your specific health history. Every person is unique, and your symptoms may present differently. When in doubt, always err on the side of caution and get it checked out. Thank you so much for your time and your attention today. My greatest wish is that you never need to use this information, but that you always have it, just in case. Be safe, be informed, and be well.